Ever wondered what a head-to-toe nursing assessment is? It's a foundational skill in the healthcare world, a comprehensive evaluation that helps nurses understand a patient's physical condition. It involves 4 primary techniques: inspection, palpation, percussion, and auscultation. So buckle up and dive in as we break down this essential process. Visualize the first step, assessing the general appearance. It begins with an inspection, observing the patient's overall demeanor, posture, and facial expressions. A nurse then palpates or physically feels the patient's skin to discern its temperature and moisture levels. Percussion and auscultation, which are tapping and listening, are usually not applied here. Next, the head and face enter the spotlight. Inspection involves observing the head's shape, hair distribution, and checking if facial features are symmetrical. Palpation here would mean checking for any tenderness or masses on the scalp and face. Moving on, the eyes demand attention. They are inspected for symmetry, sclera color, and any signs of discharge or redness. A gentle palpation around the eyes checks for tenderness or swelling. The ears are next in line. They are inspected for symmetry, any discharge or redness, and palpated gently to check for tenderness. The nose isn't left behind. It's inspected for deformities, redness, and discharge, and palpated to check for tenderness. The mouth and throat are next. Inspection here involves checking the oral mucosa, lips, gums, and throat for lesions, ulcers, or redness. Palpation helps identify any tenderness or masses in these areas. The neck follows suit. Inspection involves observing the neck's position, range of motion, and checking for masses or swollen lymph nodes. Palpation here helps check the neck and lymph nodes' size, tenderness, and mobility. The chest and lungs take center stage. Inspection involves observing the chest's symmetry, respiratory rate, and signs of strained breathing. Palpation assesses tenderness, chest expansion, and tactile phrenitis, a vibration sensation. Percussion helps identify resonance or dullness, while auscultation listens for any abnormal breath sounds. Next, the cardiovascular system is assessed. Inspection checks for visible pulsations, swelling, or chest deformities. Palpation involves feeling peripheral pulses. Auscultation listens to heart sounds. The abdomen is checked next. Inspection observes the abdominal contour, masses, and any visible pulsations. Palpation involves light and deep touch to check for abdominal tenderness and organ enlargement, while percussion assesses for tympany or dullness. Auscultation listens to bowel sounds in all quadrants. The musculoskeletal system follows. Inspection observes for deformities, muscle wasting, or asymmetry, and palpation checks the joints and muscles for tenderness or crepitus, a crackling sensation. The skin is then assessed. Inspection examines the skin for color, temperature, moisture, rashes, lesions, or pressure ulcers, while palpation checks for skin turgor, swelling, and texture. Finally, a neurological assessment is conducted. Inspection assesses the patient's consciousness level and cognitive function. To summarize, a head-to-toe nursing assessment involves a systematic examination of the patient using inspection, palpation, percussion, and auscultation. Starting from the general appearance, moving to the head, face, eyes, ears, nose, mouth, throat, neck, chest, lungs, cardiovascular system, abdomen, musculoskeletal system, skin, and finally, the neurological system. This systematic approach ensures a comprehensive understanding of a patient's health status, enabling targeted care and treatment. Remember, each step is crucial for a complete picture of a patient's health, so keep this guide handy for your next patient encounter.